Hello everyone, my name is Sean Melchua Baldivia and I am going to perform the moist compress. Definition: it is a warm, moist, local application to a body area. Assessment: assess for circulatory compromise in the area where compress will be applied, including skin color, pulses distal to the site, evidence of edema, and presence of sensation. 2 is assess situation to determine the appropriateness for the application of heat. Confirm the physician's order for the compresses, including solution to be used, frequency, body area to be treated, and length of time for the application. 4 is assess vital signs, especially respirations or debilitated patients before applying heat. Objectives is to conduct heat through moist application to produce local vasodilation, to improve tissue metabolism in an infected area, to increase circulation for an injured area, to promote comfort for an injured area, to hasten suppuration and soften exudates from a wound. Equipment is prescribed to moisten the compressed material warm to 105 to 110 Fahrenheit. Container for solution, sterile gloves if necessary, waterproof pad and bath blanket, dry bath towel, tape or ties, sterile bath thermometer if available to check the solution's temperature, sterile supplies to replace the wound dressing after the procedure is completed. General considerations are: do not apply war compress when there is a tendency to bleed because of vasodilation effect on the blood vessels. Very thin or damaged skin is more susceptible to injure from heat. Non-intact skin and drainage from wounds are indication to wear gloves. Diabetic clients, victims of stroke, and clients with peripheral neuropathy and are particularly at risk for thermal injury. Form is warm, moist, compressed, may either be sterile or clean depending on the area for which they are ordered. For sterile solution use, sterile forceps to wring out gauze to sterile. Precautions are indicated when compress is applied to open wound. And consider age of patient, body part involved, and type of treatment. Determine safe temperature of application to prevent burning. Step 1 is check physician's order for Sitz bath. Identify the patient. Positive identification of the patient is essential. Explain the procedure. Close curtains around the bed and close door to room if impossible. This ensures patient's privacy. Perform hand hygiene and put on clean gloves. Hand hygiene deters the spread of microorganisms, of course. Assemble equipment in the bathroom. Organization facilitates performance of tasks. Raise the lid of toilet. Place bowl of Sitz bath with drainage ports to rear and infusion port in front in the toilet. Fill bowl of Sitz bath about halfway full with a tepid to warm water. Sitz bath will not drain appropriately if placed in a toilet backwards. Remove the patient's clothing and any dressing that are present. Assess the area being treated. Clamp tabbing on bag. Fill the bag with the same temperature as mentioned above. Hang bag above patient's shoulder or height on IV pole. If bag hang lower, the rate of flow will not be sufficiently and water may cool too quickly. To assist patient to sit on a toilet and provide any extra draping if needed, insert tubing into infusion port of Sitz bath. If tubing is placed into a Sitz bath before patient sits on a toilet, patient may trip over tubing. Filling the Sitz bath ensures the tissue is submerged in water. Clamp tubing once Sitz bath is full. Instruct patient to open clamp when water in a bowl becomes cool. Cool water may produce hypothermia. Patient may become lightheaded due to vasodilation, so cold bath should be within reach. Place a cold compress at the back of the or the neck to help the alleviate feeling of weakness. Less amount of blood in the head will cause to faint. An ice cap is applied to cause the blood vessels to constrict so the blood will remain on the head. When the patient is finished, in about 15 to 20 minutes, help patient stand and gently pat perineal area dry. Assist patient to bed or chair. Ensure that the call bell is within reach. Patient will be lightheaded and dizzy due to vasodilation. Patient should be not stand alone, and bending over to dry soft may cause patient to fall. Empty and disinfect Sitz bath bowl according to agency policy. Remove gloves and perform hand hygiene. Proper equipment cleaning and hand hygiene deter the spread of microorganisms. Evaluation. Increased circulation occurs to affected area. Increased warmth occurs to area of application. Suppuration progresses. Pain is decreased with heat application. Recording and reporting. Record procedure on patient's chart. Date and time bath was given, temperature of water, duration of bath, effect and reaction of the patient.